your life has been dedicated, at least in the past 10, 20 years, I don't know, to helping people cope with trauma. And this is a time where there's going to be, if there's not already, great trauma because of the loss of lives, the worry, the loss of financial security for so many, and so many other aspects that just kind of stop our life in the tracks. And I thought that maybe the best use of our time here would be for you to, in your experience, give people a few practical ways of looking at it and things to do that will help them through this time.
Sure. Well, I think the first thing is to do exactly what you and I are doing now, is to realize that we are experiencing trauma and not to pretend, oh no, I can, everything's going to be fine. I can get through it. I'm tough. I'm strong. So the first thing is to realize what's happening and to be open to experiencing all the feelings that are there, the feelings of fear and anger, and also, the other feelings, the feelings of love and affection, whatever's coming up. Trauma gives us that opportunity, and it's also a necessity. It's the first step in dealing with trauma. One of the most difficult things for people who've been traumatized is that they don't realize what's going on. And I'm sure you've seen this lots of times. People come, meet people, or people come into the office and they have all these symptoms, and they have, this fear and the anger and that they don't understand. And often enough, it's coming from trauma. So it's really important to understand that there is trauma there, and that the things that we're feeling, many of the emotions that we're feeling, many of the thoughts that we're having that seem to us strange or ominous, that they may well have their root in the trauma we're feeling. So that's number one. Number two is we have to, and I know you know this very well, we have to bring ourselves into balance. When we're traumatized, we tend either to go into fight or flight. We're anxious, we're agitated, we can't concentrate, we can't sleep, we're worried about what other people are doing or doing to us. We've got to bring ourselves back into balance. And that's where meditation of any kind becomes so critical. And I think that meditation is the path. I don't know if it's the royal road exactly, but it's perhaps the elegant winding path that will help us move through trauma. And I begin with people, whether it's in person or we're teaching a training program or doing a workshop in the middle of a war, or the pages of my book, The Transformation, Discovering Wholeness and Healing After Trauma. I begin with teaching people slow, deep, soft belly breathing. Breathing in through the nose and out through the mouth with the belly soft and relaxed. Perhaps saying soft as you breathe in, belly as you breathe out. Feeling the relaxation in your belly. Noticing thoughts as they come, letting them come. Letting feelings come, letting them go, and bringing the attention back to the breath and to the words soft as you breathe in, belly as you breathe out. What that does is it is the antidote to the fight or flight response. It begins to establish balance in the body and the mind, what the old physiologists used to call homeostasis, coming into balance. And it makes it possible for us to do all the other things that we can do to help and heal ourselves. All the ways we can mobilize our imagination, our creativity, the ways we can use our physical body to help ourselves. And also it helps us move more easily toward other people and feel connected to other people who are so important to us when we're going through a traumatic time.
And how much time would you say is the minimum time to do that exercise? I was just doing it, by the way, when you were speaking.
God, I was too. That's the idea. We need to do it all. Well, I think we should be doing it all the time, really, basically. But when I teach it, I usually teach it initially for about 10 or 12 minutes. And as I teach it, I teach the physiology as well. And people who want to see me doing it on the Center for Mind Body Medicine with me, and it's also, that's the way I teach it in the transformation. But some people can't sit still for 10 or 12 minutes. So if you do it for 3 or 4 or 5 minutes, 2, 3, 4 times a day, that's great. The idea is not a specific meditative technique. There are, as you know, there are thousands of them. These are, the Zen Buddhists say, they're fingers pointing at the moon. It's not the technique that we're supposed to fall in love with. It's that moment-to-moment relaxed awareness that the technique can give us. So I suggest to people, do it as much as you can. Do this soft belly breathing whenever you're anxious, whenever you're fearful, whenever you have a confrontation coming up that you don't know how to deal with. Whenever we have a staff meeting at the Center for Mind Body Medicine, we begin and end the meeting with soft belly breathing, just a few minutes, and it helps us let go of whatever is preoccupying us and bring us into the present moment. And when we close the meeting, we close it with another few minutes of soft belly breathing, because it's time to end that meeting and be fresh and present for whatever's happening next. So as often as you can do it, do it.